CHAMPS, a research project in Bombali and Bo district, is focused on child mortality and stillbirth. Their data is being tendered to the Ministry of Health for preventive and curative measures. The Deputy Site Director of CHAMPS Sierra Leone, Eric Kaluma, said since 2017 they have collaborated with the Health Ministry, stakeholders and other partners to implement community engagement across the board and usher other necessary supports to minimizing under 5 deaths.
So if I can give the numbers that we register, because we have a small catchment population that we target, from Bombali, Shebora and Shiari, we have been able to register 230 cases in the last 12 months of child deaths that we have enrolled in CHAMPS and been able to collect samples and been able to start giving back feedback to the families on the definitive causes of death. However, many more of those cases do not, they go unreported, and that is made aware. And the better data that you can get is it could come from the DHMT, as they cover the entire district generally. What we have is a smaller version which can be extrapolated to make sense in the district and the entire country.
The Child Death Audit would provide the hospital a clear path as to the handling of child health holistically. So far, it has been discovered that most of the deaths were as a result of negligence and delay on the side of communities, lethargy and administrative blunder on the side of health workers, and inadequacy of the required drug supply on the side of the ministry. Dr. Joseph Silvanos Bangura, District Medical Officer, Bombali.
I always say the death of a child is not a spontaneous event. It's a sequelae of event that's emanated from the household and then, ultimately culminating in the child death in the health center. And I believe stakeholders together with the hospital management will have to work in collaboration to ensure that we improve on child survival. And that is one of the essence of this child audit, child death audit feedback, which we had today.
Head of Pediatric Regional Hospital Makeni, Dr. Masire Kamara, said every week they selected 2 cases in which they discussed at length what contributed to the death and also advanced measures on how to handle similar cases going forward.
Some of the major challenges has to do with availability of supplies, equipment that we need to make our work lighter. And those challenges are beyond us, because most of us working, we can't be taking our monies out of the pocket to pay for the drugs and other things that we need to make our patients well. But we need people to come in and do that. So we usually go to the ministry, the administration of the hospital. They have their own challenges. And some of those challenges, they will come in and help just for a few minutes, and later they start appearing again. So if you happen to have another case with similar presentation, they will all suffer the same. So for you to reduce that one, we wanted stakeholders to be part of what our constraints are, to understand our problems, so that people will not be just blaming health workers. We are health workers, we have the knowledge, we have the skills, but we need something to make our work easier.
Stakeholders, including the Deputy Mayor of Makeni City Council and the Chairman of Paramount Chiefs Bombali District, expressed commitment to engage their constituents on the needs to see the hospital as the first point of call, urged the ministry to implement stiff disciplinary actions against health workers who fell short, and at the same time encouraged the ministry to improve the welfare of their workers and ensure all necessary equipment and drugs are available at all times.